Welcome back to Wall Street Week. We are talking with Cleveland Clinic CEO Toby Cosgrove. And earlier this week, I spoke with molecular biology pioneer Dr. Craig Venter on Mornings with Maria. And he says he is cheating death with a new test. Watch. How do you cheat death?
Well, for example, with cancer, we have a new technique in the MRI that cancers light up like a light bulb. We have 5 people now where we found high-grade prostate cancer where they had no symptoms and normal PSA.
So you think people will be living into their second century?
I think much more will.
That was Dr. Craig Venter along with Kevin McCarthy, the majority leader, joining me this past week on Mornings with Maria. I'm back with Dr. Toby Cosgrove, and I think that was so interesting what Dr. Venter said just there, Toby. I know you know him very well. Tell me about this idea that you can go to his company, Human Longevity, take a test. He's got one test for $25,000, got another test, a smaller test, fewer tests for $7,000 or something like that, and you can get ahead of disease. And he thinks you can actually live into your second century.
Well, I think we are going to see life expectancy extended, and I think our understanding of genomics is going to be a big part of that. Increasingly, we're going to get ahead of being able to predict who has a certain proclivity for a disease and begin to monitor them specifically along those lines. I see the day when every child being born is going to have a full sequence done, so we're going to know more about what their history is going to be as they go forward. We're just learning more and more and more about this all the time in all kinds of ways, and I'm very enthusiastic about beginning to use genomics as part of prediction and early detection, and also it's going to enter into how we treat things like cancer and sequence the tumor and figure out what the right drug to give for the particular cancer tumor.
So I assume that's going to spawn a whole new string of companies and innovations in terms of getting ahead of disease. You know, I think that ever since Craig Venter and his colleagues mapped the genome 20 years ago now, we've learned so much about what you said, you know, what causes cancer. You know, we've stopped smoking as much, right? What causes heart disease? We're eating differently. We haven't seen enough around the brain, Toby, and I want to get your take there because I was told by the CEO of Merck the other day, Ken Frazier, that if you lived till 85 years old, you have a 1 in 3 chances of getting Alzheimer's disease. So what knowledge do we have on Alzheimer's, on autism, and on issues related to the brain?
Well, I think the brain is the big new frontier, and I think functional MRIs of the brain have been able to help us enormously understand what's going on. The 2 things that worry me about society is, as you might point out, Alzheimer's and autism at the 2 ends of life, which are tremendously expensive, emotionally very taxing, and really don't have major breakthroughs in understanding either the etiology or the care of either one of those. So now autism or Alzheimer's now moved up to the 7th leading cause of death in the United States, and the economics of this are really frightening. We are in the process of researching it like many other people are, and we're learning more and more about it, but still no major breakthroughs that are going to reverse that problem. I think the best thing you can do is the same things as you do for your heart. Exercise, appropriate eating, weight under control, no smoking, and those things all reduce inflammation, which is certainly part of the problem.
Yeah, you make great points. So the million-dollar question, of course, is how do you get the cost of health care down, Toby? Aside from getting in front of disease, trying to be preventable, make sure you're preventing disease from happening, what else can you do in terms of lowering the cost?
Well, we think that you can begin to lower the costs, as I said, by bringing hospitals together into a system. And just think, for example, do you have to have everybody purchasing independently, or could you purchase as a group and reduce the cost of things? That's one way you can do it. Then there are other ways. Ultimately, we're going to have to look after patients differently. Right now, we are using what we call group visits, where 10 or 12 people with the same problem will get their instructions at one time. That they like that because it is like group therapy, and also it improves the efficiency of physicians. Then there's virtual care. And we think that you can do an enormous number of things that you don't have to come to the hospital for. You can monitor people at home. You can see people post-operatively. You're going to be able to see them on your cell phone. Right now, we have an app that you can see a Cleveland Clinic doctor on your cell phone anytime, anywhere. That changes and makes care more affordable and easier on people. And clearly, we can predict people's problems and get them taken care of in an appropriate time.